Hi, my name is Brian Myers, and I'm a physician assistant here at Baseline Primary Care. And I'm here to talk to you about procedure setup standardization. And this is for the toenail removal procedure. So today we're going to review what the setup is for a standard ingrown toenail removal or infected ingrown toe. And just like all of our procedures, we start out with our photo that we use as our baseline for setting up. So what we're going to do today is review how you set up this procedure, and this photo acts as a visual recipe. So all of the ingredients that need to be laid out for your provider in order to set up appropriately for this procedure are in this photo. And I've used this photo to then set up the actual procedure here. So first of all, we have our Mayo stand here, which is a stand on wheels, which is helpful for your provider. And that's going to have the toenail pack on it. And this is a sterilized pack that has all the instruments needed for a ingrown toenail removal. We also want to lay out a nail splitter, as some of our providers use that when they're removing an ingrown nail. Now moving over here, we've laid down a chuck to create a nice clean surface to lay out our ingredients on, and I'm going to go through each of these ingredients for this procedure. So first of all, before we can remove an ingrown toenail, we're going to have to numb the toe, and in order to do that we need lidocaine out, and this should not have epinephrine in it because we never want to put epinephrine in an appendage like a finger or toe or nose or ear. We're also going to put out sodium bicarb because when these are combined it makes the injection burn less. We want to have the ethyl chloride out because that is used to cool off the toe prior to the injecting the anesthetic. And that's because the toe has lots of nerves, and so this tends to be a little bit of a painful procedure for patients, at least until the lidocaine kicks in. Prior to drawing up the procedure, the provider needs an alcohol prep pad to clean off the quick draw tops. And all injectables that you put out need to have quick draw tops on them because that helps speed up for your provider. So if you're putting out a new lidocaine, go ahead and install a quick draw top in a sterile fashion. You're going to need a syringe to draw up the lidocaine in, and then you're going to need needles to inject it. Each provider uses a little bit different needle. Some use a nice small needle like a 30 gauge, and some find that the toe is very tight and it's hard to get the lidocaine into it, so they use a larger gauge needle that allows more liquid to go into the toe. Moving along, we need 2 ChloraPreps set out, one for cleaning prior to injecting for the procedure, and then another we can use to clean after the procedure is completed. We also want to put out some gauze sponge packets, and we need several of these because the procedure does involve quite a bit of bleeding sometimes. I like you to go ahead and open it, and in one of these gauze packets I want you to pour water in and make a wet sponge so that we can soak up blood and clean the field after we work. Finally, moving around, we need things for bandaging the wound afterwards. And just prior to bandaging, we will often use something called phenol, which is a caustic chemical, meaning a chemical that is destructive to tissue that we can then kill the nail bed if a patient prefers, so that their nail will not grow back in that location. This needs to be laid out as well, and your provider will be using that on their own. Also for bandaging, I like to use antibiotic ointment to help with infection. I'm going to use something called a zero-form gauze, which is a thin version of zero-form, which is a Vaseline impregnated gauze to put on the surface of the removed toenail that won't allow anything to stick to that area, because these areas are really prone to stuff sticking in it. So this will be wrapped around the toe and it will never adhere to the wound. It's a great product. And then after the zero-form is on, your provider will use soft form roll gauze and roll it up to absorb any blood from this procedure, and then they'll often hold that all on with Coban, and that protects the soft form from getting dirt on it as the patient walks around and helps hold it on to the toe. We also want you to lie out a post-op shoe because patients often will bring in a looser fitting tennis shoe. They're never going to be able to get a wrapped up toe into a tennis shoe. So unless they have sandals, they're going to need to leave the clinic in a post-op shoe, and you can pick the appropriate size and put it out so it's ready to go for your provider. And then just as a quick reminder, as far as patient setup, obviously make sure that their shoes and socks are off on the affected foot, and then underneath that foot on the procedure room chair, you want to put on the floor several chucks to absorb blood from the procedure. Thank you so much for using our visual recipe for setting this up and for getting everything out as pictured so that you and your provider can work closely together to get this procedure done quickly. Thank you.